For those of you who don't know, we do record our meetings for anyone who isn't able to make it at the time. And we're going to just go ahead and jump right into the updates for our meeting. I am Shelley Summer. I'm the manager of the Weighing In program at Children's Mercy. Thank you again for joining us. I know some of you joined during the breakout rooms, but we're really happy that you have chosen to take the time out of your day to be here with us. I hope you enjoy the networking piece as much as I did. We're really, really excited to plan for getting back to in-person meetings in 2023. Feel free to share any thoughts or feedback you have on that, any topics you might want to hear in 2023 in the meeting evaluation that you'll see at the very end of the meeting. So I've already gone through the agenda for the day. It's a little bit different than our normal agendas. We're going to go ahead and start with updates. I'm going to start with our physical activity plan updates, specifically focusing on upcoming meetings. So if you're not already participating in our physical activity plan sectors, we highly encourage you to do so. So we have a couple of meetings coming up next week and then 2 more the following week. Please make note of those dates and times. In a few minutes, I'll share how you can register for those meetings to ensure that you have the Zoom link and easy access to that. So schools and early childhood are both on December 8th. Sport is on December 14th. Parks and Rec is on December 15th. For the healthcare sector, their next meeting isn't until the end of January. There is a little bit of a lull in what we have going on right now, but the one thing we are continuing to do through the healthcare sector is our Just Walk walks. Our next walk is going to be hosted on December 10th. For those of you who aren't aware, we host monthly meetings on monthly walks on the second Saturday of the month. They're led by a healthcare professional. We always have children's activities available at those walks, so we really encourage you to join us. We are currently planning to host this outdoors at Pearson Park at Shelter 1. If you scan that QR code and want more information, you can find it there. You can always email us at justwalk@cmh.edu if you have any other questions, or feel free to join the healthcare sector. And then I think I saw Dr. Joey Leitner sign in. I'm going to turn it over to Joey and Katie for just a minute. We're really excited to launch the public health sector in 2023. They're going to host a quick meeting on December 15th for people who are interested to learn a little bit more about the effort. So Joey, if you're on, I'd love for you to take a second to introduce yourself and share any other information about the meeting that you'd like the group to know.
Well, thank you, Shelley, and hello, everybody. I don't know if I know everyone here, but I get to work with these great folks, Katie, Shelley, Robin, all the time, and I'm really excited about kind of moving physical activity forward in the public health sector. I come from public health, so I was the bike ped coordinator for the city of Manhattan, Kansas, for about 5 years, and you know, Manhattan is the most bike-friendly city in the state of Kansas. And worked at the KCMO Public Health Department, and now I'm a researcher at the University of Missouri, Kansas City in the School of Nursing and Health Studies. I lead our undergrad in public health program. So, you know, I'm really excited. I think there's a lot of opportunity in public health to move physical activity forward. I think it's it's part of what we do already. And I think that, you know, kind of pushing the long-term sustainability of physical activity through public health is one mechanism in which can really like push us all forward. So happy to be here. Katie, I don't know if you have anything else to share.
No, I think you really covered everything. I do want to say that I've worked with Joey in the past. I'm really excited to be working with him again. I'll be helping support the public health sector. So as Shelley said, our first meeting is December 15th. It's on a Thursday. It's at noon. And moving forward, we will have our public health sector meeting every 3rd Thursday of the month at noon. So just something to remember, but I'll be posting right now, if you're interested in registering for this meeting, the link in the chat.
Perfect. Feel free to share. Oh, sorry. go ahead.
And I'll just say, we are so excited that Dr. Leitner is leading this group. And we wanted to have public health sector launched with back in 2020. Obviously, public health professionals had their attention diverted for a few years, and they're slowly getting capacity back. And so now is a perfect time to launch it, but we couldn't be happier with Joey leading the group. So looking forward to seeing what the public health sector comes up with.
Agreed. And keep in mind, the sector meetings are open to anyone. So if you know of someone who's not here at the meeting today and you'd like to invite them, please feel free to share this link with them. Or I'm going to run through the physical activity plan website and show you where you can find additional information, so you don't have to search your inbox to find where meeting links are or meeting dates, etc. So thanks, Joey. Thanks for the update. And we're really excited to have this sector launch. Okay, so registering for meetings. We do send out our meeting registrations through Eventbrite. They should come to your inbox. If you've signed up to participate in a sector, you can do all of this on our KCPA plan website. I'm going to walk you through that just a little bit. Give me just a second to bring up that screen. And let me see. Give me just a second. I need to pull up my link. So we've been working really hard to add additional information to our website so that you don't have to remember where something is in your inbox or don't have to have saved it somewhere. We want it to be really easy for you to find this information and share it with others. So can you see the KCPA plan website on your screen right now? Excellent. We have lots of great information on here. Our three main tabs: learn more information about the sectors and join us. So I'm going to start with join us, since we've just been talking about the meetings. You can sign up to participate in any of the sectors simply by clicking on the take part. We have a little survey to fill out. It's really just a questionnaire, your name, your email. We'd love to have your organization, and that's really important information for us because it helps us see whether or not we have the reach that we're really hoping for. Are we getting to early care and education centers? Are we reaching public health across the metro? So we'd love for you to give as much information as you're comfortable sharing, and then you're welcome to sign up for any or all of the newsletters that you're interested in. So super easy. If you are simply looking for a meeting, you can go to our upcoming meeting page, where we have a calendar that lists our upcoming meetings. So on the calendar, you can see that we've got 2 meetings on the 8th, a meeting on the 14th, and then 2 meetings on the 15th. If you click on any of those, it will take you to information about the meeting, and you can scroll down to register. When you register, we'll send updates. The Zoom link will come. I believe we're sending the Zoom link out, but if not, you'll get the Eventbrite meeting invitation. You can add that to your calendar. You click through that link in the meeting invitation. It will take you to an Eventbrite page where the Zoom link will be right there on the page you're connected to. So we try to make it really easy, especially if you forget to register for the meeting, but you've put a hold on your calendar and then you're wondering, oh my gosh, how do I get to that Zoom link really quickly without registering? This is how you do that. And as I'm going through this information, feel free to drop any questions in the chat. I'll have our team monitor that for me as I'm going through the website, but we can address your questions right now if you want to. I also want to point out under Learn More, you can find information about what we've done in the past and where sort of a little bit more about where we're going. Most recently, we hosted the Kansas City Physical Activity Summit. This was our second summit. For any of you who missed that, we have uploaded the summit program and we've uploaded the recordings from the summit. So if you missed it and you'd like to find out what our keynote speaker had to say or what might have been shared in the breakout sessions, feel free to watch that video and learn more. We're trying to make it easier for you to access the information and recordings by including links right here on our website. The other thing I want to point out, if you continue to scroll down, some of you may remember that we hosted sector special events prior to the summit. You may have been able to participate in some you may not have been able to participate in, but you would be interested in hearing what those speakers had to say. We have each of the sectors that hosted their special event and a direct link to the recording. So for any of you who'd like to see what happened in any of the different ones, especially as you hear what we have going on, all the exciting work we have going on in the different sectors, you can go to this page, scroll down, and have links to each of the recordings right here. I hope I'm not making you dizzy as I'm scrolling through here so fast. The other piece I want to make sure you're aware of, we've updated some information. As I hope you all know, we are connecting our work to the national efforts going on. That means we're connecting to the National Physical Activity Plan and the U.S. Report Card on Physical Activity in Children and Youth. For those of you who aren't aware, a new report card was released this year. We have updated the information on our website to include that new report card. So if you're looking for it, all you have to do is go to our website, click on the U.S. report card, and you can read the report in full here. Okay, well, those were the big things I wanted to highlight, but before I jump off this and go back to other updates, are there any questions that you all have or things that have been missing or you'd like to see or wonder where to find quickly and easily?
We have a question in the chat about what is happening with faith-based.
Oh, faith-based settings. We are anxiously awaiting, I'll say, the return of our sector lead. We've been on pause for just a little bit for a couple of reasons. One has been related to all of the issues surrounding in-person church services. We feel like those are beginning to improve, and our sector lead had to take us a little bit of a hiatus, and we are looking forward to starting those that work back up again in 2023. Excellent question. Thanks for asking, and I'm glad there's interest. Anything else I'm missing there, Evelyn?
No, just, oh, somebody's speaking.
This website looks just wonderful. I've not seen it before, and it's just simple and clear, and a great job.
Yeah, I was just going to say Shelley gets a lot of credit here because, we're public health professionals. We don't know how to do websites, and she has spent so much time working with our website support people to get this functioning in a great way. And as she said at the top, this is designed to be the place you go for information. And I think that it's in a really good place right now.
Thanks, Robin. I couldn't do it without a great techie team since I don't have those skills, but they are able to translate my jibber jabber into great things on the website. So we want to recognize them too. Thanks for that, Cindy.
Yeah.
Okay, so another great announcement we have as we move forward into 2023 is moving into implementation activities. So for most of our sectors, we've already identified strategies and tactics that if implemented would result in increased rates of physical activity in Kansas City. Thanks to the Enid and Crosby Kemper Foundation, we now have some funds available to support implementation activities. So I'm going to let Robin talk a little bit about opportunity here.
Yeah, so when we started the Kansas City Physical Activity Plan, one of the things we wanted to make clear is we weren't creating one of those bureaucratic plans that is created and sits on a shelf. We wanted this to be a plan that can be put into action by anyone. And of course, to put the plan into action, it typically requires financial support. We were lucky to kickstart this process by receiving a gift from the Kemper Foundation that will allow us to fund implementation projects in each of the 10 Kansas City Physical Activity Plan sectors. So we have at minimum $10,000 in each sector to support projects. I say at a minimum because we will be awarding these funds on a quarterly basis throughout 2023. And if certain sectors don't use their allocation of funds, we can redirect those funds to other sectors. So there may be more funds than the 10,000 for a given sector. These funds are open to anyone. However, they will be, the process to apply for them is through the sector. So a group or an organization would submit an application through the sector leads, and they would go up to what we call as the core work group of the Kansas City Physical Activity Plan, which represents all the different sector leads, and they will approve the funds. So you need to be working within the sector and the sector lead to identify projects that align with the strategies and tactics for each sector. So funds will be awarded based on how well they align with the strategies of that sector, the strategies and tactics of that sector. Those are all available on the website that Shelley was just showing. We will also consider how many different levels of the system they focus on. So for example, it is okay to apply for funds to do like a one-time health fair. That's fine. But you would also need to pair that with a program that focuses more on like an organizational level change or a policy level change, because we know that working on multiple levels of a system are more likely to result in change. So it's got to be multi-level. And then the final piece is we will consider whether it is a cross-sector collaboration. So for example, I'll just say if the public health sector is working with the school sector on a program for safe routes to school, that would be viewed favorably because it crosses multiple sectors. The application and instructions are all available through your sector leads. So my suggestion is, if you're interested in applying for these funds, the best thing to do is to attend the next sector meeting. And if you can't do that, reach out to the sector lead and arrange a time to meet with them to discuss that application. As I mentioned, we'll be accepting applications on a quarterly basis. Starting this month. So people who have been attending the sector meetings regularly have known about these for a couple months now, this application process for a couple months. So we anticipate getting some applications in the next couple weeks to be reviewed at our December meeting, but that's okay if you didn't get something in now. We will be accepting applications for the March cycle up until mid-March or so. So any questions from anyone? Or Shelley, did I leave anything out?
Great explanation. Thanks, Robin.
Yeah, we're just very excited to send funds out to our community partners to implement some of these projects. Hopefully, it is our hope that you are already doing similar projects that align with the strategies and tactics for a sector. So these funds will just, kind of supplement what you're already doing, or might be able to add something that can create new opportunities for that programs.
Great. Thanks so much for that. Okay, and moving on into other updates. Welcome to Natalie. We are really excited to announce the newest member of our team. I'm going to give Natalie just a second to come on screen and unmute herself. This is, I think, her 4th day on the job. So perfect timing to meet you all. Natalie, I'd like you to say hi and just tell us a little bit about yourself and your background.
Yeah, hi everyone. I'm originally from Kirksville, Missouri. I went and got my master's at K-State in public health. After that, I worked as an AmeriCorps Vista for the YMCA, and I mostly did like their social service programming. They offered me a program coordinator position after that. That's where I got involved in a lot of the community groups, Extension in Kansas and the Health Coalition in Wyandotte County, and then organizing some of our like mobile food pantry things throughout the metro area. Then the pandemic hit, and I've been working more remotely in nonprofit consulting and doing a lot of grant writing. But my friend who knew I was looking for more variety in my scope of work sent me this position, and it just seemed to fit perfectly with what I'm interested in and my background. And I'm really excited to meet all of you and start working with you.
We're really excited to have Natalie on board, and I went ahead and included some of her highlights from her resume because, as you can see, she connects really well with our partners that we've had for a number of years. So her background and experience is going to be a great addition to our team. So as of January 2023, we will be fully staffed for the first time in 5 years. So we're really, really excited about that. Welcome to the team. You'll be seeing Natalie at more of our sector meetings and supporting a number of our sectors and initiatives. So again, welcome to the team. Okay, so just for fun, I know you all hear me talk about the garden a little bit at these meetings, so I thought I'd just share a wrap up from the 2022 garden season. For those of you who don't know, we were able to expand the garden again this year. We were able to add 2 raised beds and 17 fruit trees, expand our irrigation, and add a shelter. So now we have 8 raised beds, a 17 fruit tree orchard, drip irrigation to everything, a shelter, a shed, paved access. So if you see the picture of the shelter, you can sort of see that concrete pad, and we have a paved sidewalk up from the city sidewalk at a slope that meets ADA standards. We also have beds of different sizes. They're called singles, doubles, and triples, so that people of differing abilities can participate in garden maintenance. And then I hope you can also see another one of our outstanding partners is Missouri Hives. They put a beehive in our garden, and I just recently got the sample from that hive a couple of weeks ago. So really outstanding. Really happy to have outstanding volunteers to help us make all of this happen. It is supported 100% by volunteers. We had over 130 individual volunteers spend around 475 volunteer hours in the 2022 season. About 550 pounds of produce were harvested, and we had, and this is an underestimate, a reach of over 200 individuals through a project called Fruit and Veggie Connect, which is delivering produce to families in their homes through a home visiting program, and also the Ruse Student Food Pantry at UMKC. We are their source of fresh produce over there. So really proud of the accomplishments we've been able to have through the garden, and are really excited for expansion of that again in 2023. We have added adaptive gardening equipment. So that's our hope for the next year, is to do a little bit more physical and occupational therapy in the garden. If you have any questions about it or are interested in joining us, you can see our email at the bottom. It's communitygarden@cmh.edu. And another outstanding announcement for 2023. I don't know how many of you might have participated in this or remember doing it, since it's been so long now, but we sent a survey out to our organizational partners, you all, to give us some feedback on a new name. We have been considering updating our name and rebranding, and have been working on it for quite some time. So for those of you who don't remember, you did inform us when we asked for options for names, and this is the name that rose to the top. So in 2023, we are going to be changing from Weighing In to the Kansas City Healthy Lifestyles Collaborative. Now we'd like your feedback again. So if you will go back to Menti, or take out your camera, scan that QR code. We have a couple of questions we'd like you to participate in to get your feedback on the name and branding. Actually, not the name, sorry, but to get feedback on the branding. So, Katie, I'm going to stop sharing and let you take over for a second.
Okay. I'm going to go ahead and progress to the next screen. So these are your logo options. I'll give 30 seconds for everyone to go ahead and respond.
And I'll just say, you know, that the logos are, the differences between the two logos are fairly subtle. And really the only difference between number 1 and number 2 are the design that's in that little circle at the top. So that's the main thing that you're probably looking to differentiate the two logos.
Okay, thank you for that, Robin. Go ahead. And now a color scheme for those logos. So as Robin mentioned, each of the very slight difference is that, you know, the circle. So you've got it in a variety of colors, color schemes, and these can be switched around. We just want to know which one.
And I guess I'll just provide a little context here too. I'll start with number 3. If you look, that is aligns with the Children's Mercy color scheme, our blue and yellow. 1 and 2 take elements from our Fit-tastic messaging campaign. And incorporate those colors. So if you can recall the 1, 2, 3, 4, 5 Fit-tastic, you'll see different colors, blues, oranges, some greens. So we're trying to connect the color scheme with both things, other programs that we've done, and both with Children's Mercy. And so that's kind of how we arrived at these colors that you see on this screen.
Thanks for that, Robin. So that was all of the questions that we had.
Katie, it looks like a number of people had some challenges voting.
Oh, no. Do you want me to go ahead and go back to the first screen?
To the QR code? Yeah. And let's allow people to sign in again or scan that. And then walk them through the questions. We trust that none of you will skew the data by voting multiple times.
So if we've already voted, we don't do it again, right? It'll add them
Correct.
together. Okay.
Correct.
Okay. So I'll give just a couple more seconds. Okay. So, and you want me to go ahead and give instructions again, Shelley? On the difference of the logo, which is the circle. So it's a very slight difference. One almost looks like a heart. And then the second option almost looks like a roadway.
Yeah, it's interesting. Katie says that because someone else said everyone sees something different. I think someone saw fountains, some see hearts, some see roads. So
I saw
this is like a Rorschach test or whatever that is. Yeah.
I'm using Shelley's example of number 2 because I thought it looked like a sewer cover. But I can see those like intersecting roadways. Okay, so that was about 40 seconds. I'm gonna go ahead. So this one is for a color scheme. I think Robin described this better than I could, he described it better than I could, yes. So 1 and 2 are kind of, the color schemes are based off of our 1, 2, 3, 4, 5 Fit-tastic. And then color scheme 3 is kind of Children's Mercy colors.
And UMKC, as someone pointed out, yes.
Isn't it United Health now too? Didn't they change their colors to be blue and like gold-ish yellow?
I don't know about
I
that.
don't know.
Yeah.
It would really like reflect the entire health science district.
Good point.
And just while we close this out and people finish up voting, we talked about this before, but it's been a while. The name change is reflective of our program's shift in focus. Let's see, 12 years ago, is that what we're thinking, Shelley? About 12 years ago, the focus was really on childhood obesity, and which was the start of weighing in. And there was a double meaning there where people could contribute, and also we were focusing on childhood obesity. And like a lot of our organizations, we've shifted our focus to more healthy lifestyles, and so we think that this name reflects that change in focus. So. But we also know that this is not a change that we take lightly. The weighing in program, I think, is well recognized in Kansas City, and so we will be thoughtful as we begin incorporating the new name, so people recognize that it's still us, just with a new name.
Thanks, Robin, and thank you all for participating in that. We really value engagement from our partners and think that your feedback is extremely helpful as we move forward and make these really sort of big changes to our work. So I'm going to turn it over to you all now and give you an opportunity to share any partner updates that you might have. I'm going to stop sharing my screen and I'm going to put myself on mute. I know in my breakout room, we had a couple of people that I think would provide great updates. They are Caitlin and Richard. So if the two of you don't mind sharing the updates you shared with us, we'd really appreciate it.
Yeah, sure. I can go first. My name's Caitlin. I work at Children's Mercy in the Heart Center. I work specifically on the electrophysiology team, so that's the electricity of your heart. And I'm the Project Adam coordinator. And Project Adam is a nationwide community outreach program that helps schools, community sites, and sports teams, things like that, become heart safe. So it helps them develop, it helps them obtain AEDs, develop a cardiac emergency response plan, and then helps them figure out how to practice this drill. so that they're more prepared for if and when a cardiac arrest were to occur. And cardiac arrests generally happen when kids are active. So it's really important that, AEDs are where kids learn, play, and like where kids are. So that's kind of how I kind of got looped into this this meeting and these programs. And I think that it's a program that a lot of you could potentially incorporate into your guys' work as well.
Thanks. My name is Rich Rary, and I am an implementation advisor with Go Knapsack, which is a part of the Children's Healthy Weight Research Group at the University of North Carolina in Chapel Hill. And we actually are in the process of doing some research on the early child care and education workforce. So you may have seen an email that came out from Dr. Willis regarding that research. I'm going to post the information in the chat box for you. But we're looking to try to get a few more child care providers to complete the resilience survey for us. So if you do have contacts in early childhood, specifically providers, not the directors or the owners of the child care facilities, that would be greatly appreciated. I think we need probably about 10 more child care providers to complete that survey. Another update, we're working on kind of a pilot study called Go Knapsack Cares, which is also on the health and well-being of the early childhood workforce. So we're piloting that here in North Carolina, then hoping to expand that out. And that's really focused kind of on weight management in that field. And that's called Go Knapsack Cares. So more to come on that. And if you do have any questions related to either the resiliency project or the Go Knapsack Cares, feel free to let me know. And the other thing I thought might be of interest to you, in North Carolina, we have a group called Eat Smart, Move More, and North Carolina, and they actually just did a presentation the other day, a webinar called Weighty Matters, Inclusive and Compassionate Approaches to Whole Person, Whole Community Health. So I'm going to post the chat to that, or the link to that in the chat box. It was kind of an informative webinar. So if you're interested in kind of checking that out, you will have the link. Thanks for letting me share.
Hi, Richard. Quick question. Do you know how long it takes for the survey to be completed?
It should take a little less than 10 minutes.
Okay.
And each of the participants, if they do participate, can be entered in a drawing for $25 gift certificate.
Great.
Yep. Thanks, Rob.
Thanks for those updates. And we're happy to share that information in our upcoming newsletter in December. So if you missed it or want links and lose the chat for some reason, we'll look for that newsletter coming out, I believe, on Monday, December 19th, straight to your inbox to make it easy and convenient for you. Any other updates the group would like to share?
Yes, so Parks and Rec sector, things are going good. Jen Jute and I from KCMO Parks and Rec, we have updated and created an application with the help of Katie as well. So thank you, Katie. And we're drafting an email, and we're going to start blasting out to all of our contacts in the Parks and Rec sector. And I'm already working with our friends over at Buddy Pegs to try and get some funding for them to do some free bike programs at some of the after school programs as well, just to get more kids exposed to bikes and get kids on bikes and get them moving and playing. And then Shelly, I don't know if you want to announce this or not, but we are working on getting an adaptive triathlon. So not for 2023, but for 2024. So just to clarify. And then Corporate Challenge is adding in some youth sports. Our special events coordinator, Katie, is awesome and set up a stroller wave to be added to our Corporate Challenge 5K. So that's super exciting. We're pretty pumped about that coming up and are hoping to get some more new parents out there that are participating companies.
We're really excited to hear all of those updates. Allison. For those of you who may not be aware, some of those came about as a result of partnerships through the physical activity plan and directly as a result of conversations and aligning back to strategies and tactics for the physical activity plan. So it's those kinds of things we really want to highlight and why we want you all to understand how important this work is and the value of being a part of our group. Looks like Robin has his hand up.
Yeah, I was just going to say that on this week has already been so crazy. I guess it was Tuesday, a group of us from Children's Mercy, the Kansas City Physical Activity Plan, and the Center for Children's Healthy Lifestyles did a group tour of the redlined exhibit at the Johnson County Museum. And I've actually been to the exhibit twice because I thought it was such important exhibit for anyone who wants to understand a variety of the social determinants of health and home ownerships and negative health impacts that we exhibit in our, or that we experience in our region. Almost all of it can be tied back to discriminatory housing practices. And this exhibit is just an excellent overview of how that came to be in Kansas City. And we weren't the first city to do it, but as someone else said, we perfected it here, unfortunately. And all of those decisions made in the 20th century, of course, are still being experienced today. So I highly encourage everyone to take time out of your day to head to that exhibit at the Johnson County Museum. It's being held until January 7th, I believe.
Great. Great. That's great information and a great, if you haven't visited the Arts and Heritage Center, regardless of this great opportunity they have right now, it is a really neat place to go, and they host a number of different activities that would be fun to participate in. Okay, well, with that, I know we've been sitting for quite some time. We're going to transition to a physical activity break as we get our presenter signed in and her presentation ready to go. So I'm going to demonstrate my technology skills one more time. Hopefully it works fine. And we are going to, I encourage you to stand up, leave your screen on, turn your screen off. It doesn't matter, but let's take a few minutes to stretch, and then let's be back by, let's say, 10:10.
Shelley, we're not hearing the audio. I think you've got to click that box on your.
And I had even practiced this. How's that?
Got it. Got it.
Switch to the safety.
I'm trainable.
Try to relax your neck as much as possible. Reach those fingertips down. And then we're going to take both hands behind the head. Elbows forward, pull down, round in the neck. You can kind of rock your head side to side here if that feels good to you. And then we're going to go into some shoulder rolls. So just a few to the back. And a few to the front. And then we'll cross one arm over and pull, and we're going to add a torso rotation here. So just rotating to the side. Should feel this all throughout that shoulder. same thing on the other side. Rotate the other way. Good, and we're gonna go into our lat stretch. So bend at the waist, reach over. You should feel this stretch all the way through the side of your body. And switch sides. Same thing on the other side. If you need some extra help or pressure, you can grab that wrist and pull for a little bit of extra on this stretch. Good, and we'll switch to our lower body. So we're gonna start with the quad stretch. If you're still seated, you'll need to scoot to the end of your chair, turn to the side, hopefully you're standing with me, and then really push those hips forward. You should feel this all throughout the front of your leg. And then we're gonna take that foot that we have hold of, sweep the leg through, heel down, toes up, reach down with the toes. The opposite hand can just be supported on your knee. And if you can, pull back on those toes, move a little bit more calf. And come up, good. We'll do the same thing on the other side. Quad stretch first. Pull that heel in, push the hips forward. Run all the way from your hip joint, all the way down to your knee joint. And then swing that leg through, heel down, toes up. Reach down for those toes. Pull those toes back. And come on up. Last lower body stretch we're gonna do is our glute stretch. So cross that leg over. Squat down, push the knee down, hold on to something if you need to. Apply pressure on the knee, flex that foot. And if you need more of a stretch, go ahead and move your chest a little bit closer to your leg. Good, switch to the other side. Same thing. Cross the leg over, flex the foot, push the knee down. Relax that glute as much as possible. And move your chest closer to your knee if you need to. Good. All right, last thing, interlace those fingers. Round in the back, rock side to side. Couple high, couple low. And whenever you're ready, reach all the way up. Big deep breath in. Exhale, reach down for those toes. Or you can grab your elbows here and rock side to side. Release the lower back a little bit. And then let's pedal our legs a couple times. So bend one, bring the other. Then switch. One more time. And roll back up nice and slow whenever you're ready. That's all I got for you guys.
I hope you all enjoyed that. We're going to take a few more minutes just to use the bathroom and refill drinks. We'll be back by 10:10.
Hi, Margo.
Hi, Robin. Hello, Shelley. Sorry, I was a little bit late.
That's okay. This is perfect timing. We just wrapped up a physical activity break and gave everyone a chance to go get their drinks refilled if they wanted. And so this is perfect timing. Do you want to go ahead and share your screen, or would you?
Yes, I will. Let me go ahead and do that.
Okay, so while Margo is doing that, I'm going to give you a few housekeeping reminders and tell you a little bit about Margo. First of all, please mute yourself during the presentation to avoid echoes and background noise. I hope that we have we hope to pin Margo as the presenter to make it easier for you to see her presentation and her as the speaker. If that doesn't show up on your side, you might want to consider changing your view to presenter view so you see just her along with her slides. We will have the presentation available both as slides and as a recording. And Margo, just as a reminder, we are recording this presentation. For those of you who may be interested, closed caption is an option that's available. Be sure and check that if you want that to be enabled. Okay, with that said, I am really privileged to present and introduce Margo Quiriconi. Margo currently serves as the Director of Community Health Initiatives at Children's Mercy Kansas City and is responsible for leading Children's Mercy's community health improvement planning process, which includes the development and incubation of new programs, support for community-based organizations, and compliance with federal community benefit regulations. I've had the pleasure of working with her the entire time she's been at the hospital, and it's been a real pleasure both getting to know her and working with her. Prior to joining Children's Mercy, Margo founded the consulting group Q Works, where she worked with local and national education and health-related organizations. During her 21-year tenure at the Ewing Marion Kauffman Foundation, she led initiatives in the areas of education, health, and entrepreneurship. So she's been a wealth of knowledge to us as we've moved our initiatives forward here and weighing in. She holds a bachelor's degree in the fields of nutrition from Michigan State University and nursing from St. Louis University, and a Master of Public Health degree in maternal and child health from the University of North Carolina, Chapel Hill. In addition, Margo completed an executive program in health systems management at the Tulane School of Public Health and Tropical Medicine. So she's been in school across the country. She's lived in Kansas City for over 30 years, and during that time has served on numerous boards in both neighborhood and community organizations. But and I love this part of her bio, her proudest, accomplishment during this time is raising two great children who never say no to a Nelson Atkins museum visit and always root for the Royals. So with that, I'm really excited to have Margo here today to share the results from the most recent community health assessment that was completed this year.
Great.
So Margo, thanks for being here, and I'll let you take it away.
Thanks. I'm hoping you all can see my screen. Is that correct?
Not yet.
Oh, shoot. Well, this is because I'm on Zoom, and let me figure out how to do this. Okay, get back to Zoom. I apologize. I thought that I had done this. I'm really pleased to be with you today. Okay, here it is now. All right, so we're here. And thank you to Robin and Shelley for having me with you. And I'm going to present some of our data from the latest community health needs assessment. And most of the data I'll be presenting is relevant to you all and the work you're doing with weighing in, and also with physical activity. So many of you all—
Margo, your presentation is in not in the slideshow mode.
Okay, let me try that. I'm messing up. So is that good? No,
Yes,
good.
perfect.
Okay, good. Perfect. You'd think at this time I would be able to get this technology. So the community health needs assessment provides a really interesting look and snapshot on how are the children doing in our region. And many of you all who are not aware may be wondering, why does Children's Mercy do this community health needs assessment? Well, one of the things that happened in the Patient Protection and Affordable Care Act many years ago, where there were changes to what were the requirements for hospitals to maintain their nonprofit status. The changes involved enhanced financial assistance requirements. They expanded what's called community benefit, which is the reporting that hospitals must do every year on their 990 and what's called a Schedule H that the IRS developed that shows what our contributions are to the community in a financial sense. And they also then, in the Patient Protection and Affordable Care Act, required nonprofit hospitals to conduct a community health needs assessment every 3 years. And then from that assessment, there are requirements about having community engagement, about seeking input from the community, developing a community health improvement plan, having approval by our boards, and documenting the impact of our programs. This has been a heavy lift for many health systems. The first needs assessment for most health systems started in 2012. And, but we have seen this after we got over the initial push of doing the first needs assessment, that it really helped us to provide an incredible perspective of what were the pediatric needs across our region to help to better gauge what the community needs were, where there was important work that we needed to do as a health system in collaboration with others, and that it helped us to provide, for us to be more strategic about our approach to improving children's health. And it connects very nicely with our initiatives, such as our weighing in initiatives, our physical activity plans, our home visitation work, where we place clinics, how we can develop policies and practice to improve the lives of children. So many of you all may be aware of our previous needs assessments. They've evolved over the years. You see our 2013 through our 2019, and we've just completed our most recent assessment, which is our 2022 assessment. And that will be where I'll share some of the data from today. So one of the requirements of, and certainly always a requirement of a community health needs assessment, is identifying what your focus area is. And for this community health needs assessment, we've identified 5 counties. So those of you who know our area well can see the green, blue, and yellow counties of Missouri, Platte, Clay, and Jackson County. And then on the Kansas side, Johnson and Wyandotte County. So we evolved on those 4 counties. While Children's Mercy has a broader scope, this is where 72% of the Children's Mercy patients originate from. And that it represents, pretty close to 440,000 kids. And 24% of the total area population within here are children, and that there are over 224,000 households with children in the area. So from that criteria, we feel like we have a good sample of where we can have an impact and have a better understanding of what are the conditions that children are living with and experiencing related to their health and their growth. So we call this our focus area or our total service area for the purpose of the needs assessment. So our methodology is quite broad. It entails a variety of qualitative and quantitative data. We host community conversations with neighborhood residents. We had 3 large community conversations that allowed us to connect with 30 residents. This was reduced this year. In the past, we've had more community conversations with residents, but due to COVID and what happened with the Omicron variant, we had a number of canceled sessions, but we were really pleased to have the 3 sessions. We also, and many of you all may have completed this, we use an outside company that sends out to 300 what we call key informants. So it's a variety of representatives from government agencies, business fields, nonprofit, health departments, legal fields, who complete a survey to rank and comment on what they see are the most important issues with children's health. One of the most powerful pieces is that we use an outside firm to conduct a telephone survey of families across the area. And these do not have to be families that connect with Children's Mercy. They are, it's a randomized, stratified sample through telephone numbers and there has to be, those contacted have to have at least one child living at home. So we were able to conduct this survey this time with 1,250 families from each of those counties. Platte County is our newest county. And it's important when you're looking at this data because so many conditions have changed related to inflation, related to the reduction of the child tax credits, and oftentimes many stimulus payments, that these interviews were conducted in November and December. And we think in some of the data, and I'll share this a little bit later, may be different if we ask the same questions today for the families. And then, of course, we use our variety of secondary data. We use our some of our own internal medical records data. We use data from local surveys, from health department data. So we pull this all together and certainly look at certain demographics. And so what you see here in the area, there are close to 61,000 children who are living in poverty, and that's 14% of the children within this 5-county region are living in poverty. And Jackson County has the largest number of children in general and the largest number of children living in poverty. And while Wyandotte County has the highest percentage of children living in poverty. On the map, what you'll see in the darker areas on the map, the darker the area, the higher number of percentage of children in that area are living in poverty. And for those of us doing community work, it's pretty consistent with what we can see with the central area of Kansas City, Missouri, a pocket down in the Grandview area, areas in Wyandotte County, and then we see some new pockets where there's higher percentages of children living in poverty, where we've seen families who have moved out of these regions or changes in demographics in Johnson County, as well as in Clay County. So what I'll share with you first, and I've highlighted some of the areas, in our key informants, we ask our key informants to rate which issues they feel have anywhere from a major impact to no impact on children's health. And you certainly see that poverty, which is of course closely connected to employment and income for the families, has the highest impact on children's health. Housing, key informants felt very important. I've highlighted in red some of the areas that impact the physical activity plan and some of the work that many of you all may be involved in, where built environment and transportation, while they were rated lower and a major impact, it is acknowledged by those key informants that they do have a moderate impact on the health of children. Environmental conditions and access to parks, we see similarly before. But this is a really great rating about issues of concern from our key informants. Violence certainly rated very high, and we all know that's a challenge for our region, as well as discrimination and racism. And I was really pleased to see politics, social, and economic policies related were ranked higher in some of the areas, because we all know how important it is to have our political leaders and our social leaders thinking about what good will this be for our children and how children can be impacted by the various policies. So another question that we ask those, the parents in that survey of 1,250, we asked them about what's the number one issue affecting infants and children in the community that they see as important. And we do this by age ranges. So for under 6, if we look at this, many said they really didn't know. A number were very concerned about COVID, which in all 3 of the categories has become one of the higher issues, different from, of course, our past surveys. But if we zero into the blue area, which is the obesity, nutrition, and education, this was over 9% of the families were concerned about this, and about 7% concerned with nutrition specifically in that area. So how does this change when we ask for 6 to 11-year-olds? Well, we still see COVID being high, but if we look at obesity, nutrition, and exercise, it increases parents' concerns about those issues for kids are seen to increase. And you see an increase in parents concerned about obesity as well as exercise in that area. What we also saw starting 6 to 11 years old is we saw greater increase concern about mental health. So when we look at the 12 to 17 years, we see quite a change with mental health coming to the top concern for kids in this area. And it's no surprise to all of us about why that is true. And we've heard all the reports. If you're raising children now, like the anxiety, the social connectedness with school, and the impact that the pandemic has had on children's mental health. This is a very interesting jump. It's much higher than it's ever been before. Unfortunately, their concerns about obesity and nutrition and exercise are reduced from earlier ages in childhood, but the mental health piece really jumps as being of a prompt concern for families. What's really interesting about this is if you look at this list, and this is the perceived health issue affecting adolescents 12 to 17, and we look at our past, when we've asked this question and our 3 other surveys, there's a big piece missing here. You know, mental health kind of like takes over in red for a lot of this, but there's an area that's missing that was never on this chart before, that was on this chart before, that's not here now, and that's sexual activity. That in the past, sexual activity, parents were concerned about sexual activity of their adolescents, and this doesn't even show up. A new one that shows up, in addition to the mental health becoming so prominent, is domestic violence had not shown up as an issue, and drugs and alcohol were higher in past surveys. So this sort of gives us a state of parental concern of what they're seeing with their adolescents. So one of the other areas that we started looking at in 2015 is looking more closely at housing, because we know how much housing impacts children's health, their emotional stability, and how important, and also their ability to exercise, engage in school, and lead healthy, stable lives. And so you see this first question that we ask are the number of moves in the past year. And unfortunately, it's really high for families who have a child in 0 to 4. very low, and low income families. Very low is below 100% of the federal poverty. Low income is 185% or below. And it certainly impacts our children of color. And there were, what's interesting is Clay County somewhat jumped up this year with a number of moves in this round than they have in the past. But Clay, Jackson, and Wyandotte had more children that had moved in the past year. We also look at, which is an increasingly issue of concern, is how many children are identified as participating eligible for services from the McKinney-Vento program in schools. And that's our program that provides support for children who are experiencing homelessness. And that's from the federal definition for McKinney-Vento. So this means that you don't have to just be living in a shelter, but you could be doubling up with other families. You could be sleeping on someone's couch. You could be in a car, or you could be in a hotel room, or you could be a child kicked out of your house. And the most important piece to recognize is that 7,385 kids across all districts were identified as homeless in the school year 19 to 20. We tried to get the data for school year 20 to 21, and most of the school districts had not fully reported, so it wasn't available at the state at the time that we did this data. What we've also done is pulled out from the various districts that had 100 or more students who were identified as homeless. And so you see, if you look at the Missouri side, you see that it's across the region and all of the counties where housing is a challenge for families. It's not just concentrated in the Kansas City public schools. And the same thing is true for the Kansas districts, that you'll see based on the McKinney-Vento homeless definition, there's housing instability for kids in Piper, as well as Kansas City, Kansas, as well as Olathe and Shawnee Mission and Blue Valley. So this is a real concern for our families with children, is being able to have consistent housing. And we all know how much rents have changed. There's job instability, but a really important indicator to watch. And it's also seen for families, we ask the question if families are always or usually, sometimes, or never concerned about paying rent or mortgage. And this went up somewhat in 2021 to 15.1%, but it's been steadily increasing since 2015. We also look at housing conditions. So what's the condition of housing that our children are living in? And two of those key indicators are looking at if there's peeling paint, and if there's signs of rats, mice, or other rodents in the home. And both of those conditions have increased over the past time since we've done the needs assessment. It's not only important to look at what housing is, but what families look at about their neighborhood characteristics. So we ask questions about litter and loose garbage on the street, about sidewalks or paths, about rundown housing, about signs of vandalism. And then we compare that to what we've seen in past needs assessments. And we can see, you can see that all of those conditions increase since our past needs assessment, which is reflected in the chart on the right-hand side. When we did our community conversations, this was one of the top issues that families talked about related to their children being able to grow up healthy, is the condition of their neighborhoods. It was prevalent in all of those conversations. Mothers more and more concerned about letting their children outside, not having sidewalks, having speeding cars through the neighborhoods, violence, vandalism, not good places for kids to play. So really of concern of our area of how are we really addressing the built environment for our kids. We asked the question about food insecurity and look at that by county. And certainly we use the 2 USDA questions to gauge food insecurity. And Jackson and Wyandotte counties reported higher percentages of food insecurity. Overall, we saw a decrease in food insecurity. And this is a place I want to stop for a minute and say that if we remember that this was done in November and December, and so there were probably more families that were still having some unemployment subsidies, having subsidies related to the child tax credit, and inflation had not hit at that time with food prices. We feel, and our colleagues with other children's hospitals across the country who have been looking at food insecurity of their populations, they're seeing the same thing, that during the pandemic, we actually saw a reduction of food insecurity. We could think of a lot of things. There was more availability of food through the food programs, through extra USDA subsidies, and families had more disposable income. But now that inflation has hit and some of those other program regulations have changed and the availability of food for children has changed, everybody is seeing an increase in food insecurity. We ask questions about the type of school that children attend, but thanks to our colleagues in our Center for Children's Healthy Lifestyles and Nutrition, we started asking last year about what's the child's transportation to school. And you see in our area, the majority of parents do drive, but a number of followed by school bus or van, and then walking to school. And all of this, especially the school bus or van or a child walking to school, the neighborhood impacts and the neighborhood supports and infrastructures and the built environment all impact that. Kids have to wait at bus stops. They have to walk to bus stops, and whether or not children feel safe in that realm. We also asked the question about were children physically active 1 hour or longer of every day during the past week. And this has been an important indicator in our physical activity plan. And as you see, we saw a slight increase during the pandemic periods in parents in the reporting of this, where we had a decrease before, we saw a slight increase. This may be due to actually kids had more free time out of school and had more playtime or had different routines that were happening. But definitely in our area, we're much higher than the healthy people target and something to be concerned about. We also ask about how many number of sports teams children played on in the past year. And a bit over 40% of our children did not participate on any sports team, but you could pretty much say that over close to 50% of our kids, a little bit over, are involved in some types of sports activity, which is very positive. I certainly am concerned about those kids 4 or more sports teams, even 3 or more sports teams. That's quite a bit. And close to 18% of our kids are involved in 3 or more sports teams. We asked the question about whether children wear a bicycle helmet when they're riding, riding in the past year. And we saw a slight decrease, but overall, during the time we've been asking this question, is that we've all been concerned not enough kids of our kids are wearing bike helmets still. And so there needs to be more emphasis placed on that, and understanding about why or why not our kids are not using bicycle helmets for their safety. And so if we look at sports and bicycle helmets and some of these neighborhood conditions, we ask families about, was your child injured seriously enough to need medical treatment in the past year? And about 15% of our families across the region said that their child did need medical treatment for an injury. We then ask, well, what was your child's activity when they were most seriously injured in the past year? And close to 21% said it was a sports organized or team activity. Some just were injured in playing. And then some of the other ones, certainly across the area, falling, tripping, bike riding, and self-harm was 15.5% and was 3.3%. And we'll talk about a little bit more about self-harm a little bit later in this presentation. So bullying is an important indicator for our kids in the area. It happens at schools, cyberbullying, and we are, the purple on this chart is whether the child was bullied at school, and the blue indicators about cyberbullied. We didn't see much increases in these areas. When we look at cyberbullying, we also disaggregate this data between males or females, and females are more likely to be cyberbullied than males. Males are more likely to be bullied at school, and certainly that happens on the playgrounds and in the neighborhoods, and is another issue about kids feeling safe in school, safe in their neighborhoods, and an issue that does impact their physical activity. We look at the number of adverse childhood experiences that children have in our area. And we know that if you have 3 or more adverse childhood experiences, this not only impacts you during your childhood, but has future ramifications for mental health and other physical health experiences as an adult. And those oftentimes include diabetes and cardiovascular disease. And so close to 17% of our children have had 3 or more adverse childhood experiences, which is not a good indicator for future challenges with health. And those who have had the 3+ adverse childhood experiences, certainly the highest number was in the very low income families. And Jackson County were the highest number of kids who had 3 or more adverse childhood experiences. We look at different health conditions, and childhood obesity is one of those conditions. And you can see that persistently Wyandotte County is very high for child obesity prevalence, and and overall in our area it increased in 2021 from 2018, and from what we've seen in a trend in the past years. So this is certainly a concerning a concerning indicator. Also of concern is in Clay County, 27.4%, then followed by Jackson County. And again, much higher than the Healthy People 2030 target. This is where we use some of our own data from Children's Mercy as we looked at asthma and looked at hospitalizations related to asthma over a 3-year period. And in the dark areas, this is where there were the highest number of asthmatic cases in those areas. And this again is impacted by children's exercise levels, their neighborhood conditions, their housing conditions. And so asthma still remains of concern. We also looked at asthma-related hospital discharges based on where the child lived. And if they lived in an area that had a very high or a very low child opportunity index. And many of you all may be aware of this measure. The Child Opportunity Index is an index of a number of different factors for children that impact their health, education, and their potential. And you'll see that the majority of the asthma discharges were for children who were in lived in areas where there was low or very low child opportunity. And that has to do with the high levels of poverty, is one of the index measures, housing conditions, education in those conditions. We also looked at a series of ambulatory conditions. They're called ambulatory sensitive conditions. You can see the conditions on the lower left-hand side. And these are generally seen by researchers as conditions that if children were in the correct type of primary care or had appropriate access, they would not need to be hospitalized for these conditions, that these conditions could have been managed at home. It's also an indicator of whether or not there are, able to appropriate grocery stores in the area for foods for kids, access to pharmacies, if they're able to walk or get to their primary care providers, if they're able to get the exercise they need, what the environmental conditions are in their neighborhoods. And you see again these dark pockets. If we go back to one of the very earliest slides I shared with you about poverty, that many of our children who live in the low and the very low where there's low child opportunity have more of these conditions. It also has to do with the availability of providers in the area. So you see this pocket in Olathe that there's obviously some access providers for families into primary care physicians. We started in our last needs assessment looking at the data related to firearm injuries. And we do this over a 3-year period. And this chart that you're seeing is by the number of firearm injuries at any hospital system across the region. And we look at it by type, by the zip code, and also by the Childhood Opportunity Index per 1,000 child population. So you'll see here that, again, we see higher numbers in our central areas, but overall there were 450 children that were seen in an emergency department at any hospital related to a firearm injury. And on the chart in the upper right, you'll see that what type of firearm injury, whether it was accidental, which was the largest category of 307, which was if it was an intentional assault, if there was an undetermined intent, or if it was self-harm. You know, this is certainly concerning because we see that children across our region have access to firearms and have been injured by firearms. And one of the concerns is how do we provide the education or the environment so that our children don't have access to guns or are not in exposed to violent conditions in the terms of the intentional assaults. This is something we heard in the neighborhood conversations, is families really concerned about hearing gunfire, families not wanting their children to come out of the home, or families not wanting to go get the care because they were concerned about firearms, that they felt like there were too many guns and firearm exposures. We also look at this data specifically to Children's Mercy, and these were the injuries that came into the Children's Mercy Emergency Department. And there were 200, we saw 210 of in the past chart, you saw there were 450. So we see in our emergency department close to 50% of the firearm injuries of children in the region. And again, accidental of that we saw were 150, and then intentional assaults 54. This is the death rates from the CDC Wonder from 2018 to 2020 for children by ages over this period. And then we look at the deaths per 100,000 children in the Children's Mercy area versus Kansas versus Missouri versus Healthy People 2020. And when we look at what's startling about this chart, and it's the chart in the upper right-hand corner, is that we have far too many deaths in our 15 to 19-year-old areas, and in Missouri, much higher than what's expected from Healthy People 2020. And if we look at the causes of death for that 15 to 19-year-olds, you see that homicide has taken over accidents, and that suicide is inching up to where accidents are. And this is of concern where you see that homicide has taken over the causes of death versus accidents. You know, we used to be accidents, and largely car accidents were the cause of death for the 15 to 19-year-old population. Mental health, as we saw, was a great concern to families. We ask a number of other questions of families related to mental health, and in all of the indicators, they had increased since 2018, showing concern for our region. And this chart, it's that parents felt their child felt sad or hopeless for 2 or more weeks, and they stopped performing usual activities. We also asked actually if the child was diagnosed with depression. And again, we saw an increase in families responding that yes, their child had been diagnosed with depression. And then one of the things we looked at is that we looked at how many children came into the Children's Mercy Emergency Department with self-harm, and we looked at it with a self-harm diagnosis. So we looked at 2017 to 2021, and you saw that between 2020 and 2021, you saw an increase in the number of encounters in our emergency department related to a self-harm diagnosis for children 10 to 17 years of age. This is consistent to what is being seen nationally, that there was a dramatic rise between 2020 and 2021. And also what we're seeing is that there are more females who are self-harming versus males. And again, this mirrors what is being seen nationally in this data. So again, emphasizing how many of our children are really struggling with coping in the new reality. There was a greater need for mental health services in the past year, greater number of children needing mental health services, but still challenges with those that received treatment. A bit over 22% said that their child actually received treatment. And for those that not receiving the needed care, close to 32%, over 31%, it was availability. There were long waits, and then challenges in finding a physician. So definitely we need to be looking more closely at what's happening with mental health treatment in the area. And then we again saw a challenge that families told us that their kids were having difficulties or delays in getting the needed health care that they needed. Certainly that was a challenge during the pandemic. And that we saw a decrease in kids that were having their usual source of care for a child's medical care, all of concern, and that pretty much remained stable about how many kids had actually had a routine checkup in the area. We ask about barriers, and this is barriers to getting a doctor's appointment, barriers related to lack of transportation. We look at cost as an issue of finding a doctor. We look at inconvenient office hours. Most families want appointments early morning or in the evening, late afternoon, early evening. Saturdays are not a priority for families of getting appointments. I think families they're picking kids up from schools and they're finding sick kids, or they get home and they realize that somebody's not sick and they're not at work, or they wake up in the morning and they want to be able to take a child into care someplace. So from all of this, we presented this data to the community and identified with at our Children's Health Summit, and with looking at the data and from the input of groups of what we saw as leading child health priorities from the needs assessment. Certainly child and youth mental health, housing and neighborhood conditions being rising to the top, violence prevention, and then appropriate access to health services. Our board of directors has agreed and committed to us working on these 4 areas. We can't do this alone. We have to work with community, and this is where you all become so important. We see in housing and neighborhood conditions is the physical activity report components of work are very important in the housing and neighborhood conditions. So what's next for us? Our board approved our implementation strategies with those 4 areas on September the 14th. So we'll be rolling out more work that we hope to be doing with others. We also have funded what we call catalyst grants to 12 partners across the region for a small amount of money to help to support them and moving forward in those 4 areas. There's 4 of particular interest to the physical activity work, and that is the Urban Neighborhood Initiative was funded for their work they're doing in the Wheatley neighborhood to increase housing and after-school activities, to Harris Park to continue to increase their work, to Bike Walk KC, where they're doing some of their environmental community assessments with school communities for kids in regions further out in Eastern Jackson County and in the Raytown area. And then Public Health Partners in Johnson County, who are going to be doing some assessments around some schools with some school communities about what can increase the number of children walking to school and neighborhood conditions for kids to feel safe. We've also are working with My Sidewalk, and all of this data will be online through a My Sidewalk platform in January, so that other community agencies will be able to use this data for their strategic planning, for their programs, etc. All of this is available data right now on our website. and are in the community tab, so you can find access to the needs assessment and the data before the My Sidewalk platform will be up. And then, this is really about action. There's nothing definitive here, but we can use this data to kind of gauge where we are in the community and what we need to be looking at, not only for us as a health system, but as a community in general, and how we partner and move initiatives forward. Because we know as a health system that while we provide incredible clinical care, we do research, we educate the next professionals, if we add exemplary community programs and partnerships and connect with community, we can really work to create a community of well-being for all of our children. And this data helps us to be able to understand where we are in our programs and what we can do differently. So I'll stop there, and if there's time to questions or any comments anyone has.
Hi, Margo. Real quick, this is Joey Leitner. Sorry, real quick. You guys don't collect any data on like LGBT specific youth?
Oh, we have wanted to, and it is really complex. And we've also worked with our, our other children's hospital providers, and that is a goal for the next needs assessment. We had wanted to do more of that work in this needs assessment, but the pandemic got us, because the best way to do that work is through conversations with the groups. And it was, we couldn't get access because of our COVID policies and work, but would love to work with you all on this going forward, because it's a missing piece, and it's a missing piece on most of these community health needs assessments across the country. There are more that are looking at that. Los Angeles is doing some work in that area, and a few others.
I mean, I completely agree. And for this group specifically, LGBT health and physical activity, I think is a really important issue for these kids, especially because, these kids are suffering from discrimination, violence, and all those other mental health concerns, and don't get the positive benefit of being active most of the time. And so there's like this double whammy that hits this marginalized group.
Absolutely. And so I think, we try to add different things every year. Every round we do this. I say every year, it's every 3 years, every round, but that really has to be a priority in going forward. And we ourselves have started working more closely with Pride Haven, which is a shelter for LGBTQ youth, and largely the youth who are 18 years and above. But just from that experience, in developing the relationship, it's very clear how important it is that we need to better assess even earlier what some of the health conditions and health promoting conditions are in the environment that the kids are living in and experiencing.
And I think SAVE did a report last year, and it said something like there were 2,000 LGBT youth that were homeless in Kansas City Metro. Right. So like that is, I mean, all of these things affect that group, but not that that's the only group that should be focused on, obviously, but.
Margo, thanks for an outstanding presentation. For those of you who are still with us, we do have time for some questions, or we'd like to allow you time for questions if there are other ones. I know we're a little bit past our scheduled time. So we went ahead and put our evaluation code here for those of you who are still on. We welcome your feedback, but we'll keep Margo here if she has a few more minutes for additional questions. It looks like Natalie has her hand up. Natalie, do you have a question for Margo?
Yeah, I know you went through it fast, but on the ACEs scores, I was surprised that Wyandotte County didn't have higher numbers of that, based on them having worse health outcomes in general than the other counties. Is there a reason why that showed up in the data?
Yeah, usually Wyandotte County is a bit higher than they are before. I can show you some of the past data, but I think Wyandotte County is still high. You're talking about for the 3+ and beyond, largely because one of the key drivers in the ACEs data is parental separation or divorce. And so that drives the numbers of ACEs across all of the counties, because that gives one. And if you look at many of the children in poverty, they're not in homes where there was an experience of divorce.
Okay.
So that's one of the areas where you see it lower. You'll see some of what's interesting about some of the ACEs data for kids is this also varies regionally, because one of the other ACEs is if you have parental incarceration. And so we've done work in the past where we've compared our ACE survey data with, like, in Boston. So in Massachusetts, they don't incarcerate as many people as we incarcerate. So our incarceration rates are higher than if you look at the Boston children's data, because they have different ways of remediating. So when you look at all of the scores, and I'm happy to share with you from the different areas, but the top ACE for everyone is parent support, separation and divorce. And so that's sometimes in the Wyandotte County families, if they've never been, if they've, families haven't been married, they oftentimes don't check that.
Okay, thanks.
An interesting additional piece of information, Margo. Thanks for that. It looks like Robin has his hand up too.
Yeah, hi Margo, great presentation. Of course, as always, such great data. As you know, we use this data all the time in our work. And so I was really excited when, in addition to the electronic or paper report, that the data, some of the data will be available on My Sidewalk. So can you talk just a little bit about that and how community partners would be able to access some of that data through My Sidewalk?
Yes. So through My Sidewalk, what will happen for community partners in the past related to this data, we have put the slides of this data up on our website, and people could download the slides and use it for their grant applications, and many individuals did. So with My Sidewalk, what is happening is we've built out demographic data related to children on a number of children's conditions, where you as a community partner will be able to go into that My Sidewalk site, that we will have a link on our website in the community, and you'll be able to drill down. It's an easy way to get the census data and download that data. In addition, you will have the Children's Mercy Needs Assessment data by the different categories, where you'll be able to download these charts. So it's an easier use fashion, but there's also this functionality that you can drill down more onto the child poverty, onto the Child Opportunity Index, that we're not able to provide in the static report. And that I know that I've heard from many individuals, it's much more complicated and hard to get some of the census data on some of these features. And so you'll be able to get easier access to that. And so it's kind of like it's a big portal that's child-centered data for us, for our region, and all targeted, at our region.
Great, that's awesome. And I think I saw on a slide, January is when you expect that.
January,
Wow.
hopefully. My Sidewalk does great work, but they usually do work for all populations. And so it's been a little bit of a heavy lift working with them, because they've never done something that's specifically child-centered. So some of the tools they look at, we're like, well, diabetes is important to consider, but for kids, it's not our leading thing. That's not how we look at children's health. And certainly there are children living with diabetes. So we've been, changing some of their frameworks a little bit.
Yeah. Great. Thanks.
What other questions does the group have for Margo? While you might be considering that, we will include a link to the most recent Community Health Needs Assessment Report in our December newsletter. There will also be a link to the recording and the presentation that Margo just shared today. That report has some additional information in it that might be interesting to you all, and additional information related to the different segments that Margo mentioned at the very beginning in terms of key informant information, community conversations, as well as this over 1,200 person phone survey that was implemented. I'm really glad that you mentioned the connection to some of our partners, Margo, in terms of the funding that was made available. In fact, we've talked a little bit about connecting with Chris Harris in Harris Park and those initiatives to implement some of our other programs through the physical activity plan. Of course, Bike Walk KC is a longtime partner of ours, and as well as health departments in Johnson County Parks and Recreation. So really love to see that those organizations are applying for and receiving additional funding to support their efforts. I think that just shows the benefit of coordinating and aligning our efforts to make a difference. So if there aren't any other questions, I want to thank Margo for her outstanding presentation, and I'm going to do that in the form that we used to do when we were doing this in person, and that is by a round of standing ovation. So I invite you all to stand with me and give Margo a round of applause. Thank you for taking time out of your day to Margo, to give this presentation. As always, it's outstanding. And you provide great insights and information for us to consider as we move forward. So with that, please use the QR code to link to our evaluation for this meeting. Your feedback is valuable to us, and I wish you all a happy, healthy holiday season and Merry Fitness. With that, we'll end the recording. Have a great week, everyone.